Hello and welcome to this webinar, Making CEP Work with Low ISPs and Partial District Implementation, hosted by the Food Research and Action Center, or FRAC. I'm Steve Hayward, FRAC's Senior Communications Coordinator. Before we begin, I'd like to cover a few brief housekeeping items. We expect this webinar to run about 45 minutes. However, we're recording the presentation and we'll send the recording and slides in a follow-up email, so you'll still receive all the information even if you have to hop off. After the panelists have made their remarks, there will be time for questions and answers. To ask a question, please use the Q&A function on the bottom right of the WebEx screen. With that, I'll pass it off to Alison Perez, Child Nutrition Policy Analyst at FRAC.
Awesome. Thank you, Stephen. Hi, everyone, and welcome to this webinar on making CEP work with low ISPs and partial district implementation. My name is Alison Perez, as Stephen said, and I'm a Child Nutrition Policy Analyst at FRAC. Thank you so much for joining us for today's conversation. We know how busy everyone is, and we really appreciate your interest and your participation in this webinar. We're hosting this webinar today because community eligibility adoption season is upon us, and in light of a recently published USDA characteristic study on CEP indicating that many districts are reluctant to adopt CEP with lower ISPs, or if they can't do it district-wide, we wanted to provide some helpful strategies and examples of how to run community eligibility successfully in these circumstances. Further, given ongoing uncertainty about the future of the federal child nutrition waivers, we think it's more important than ever that high-need schools and districts consider community eligibility as an option to continue serving free breakfast and lunches to all their students for next school year. The goal of this webinar is to discuss the basics about community eligibility, to discuss strategies for making it work at low ISPs and partial district implementation, to hear from great speakers about their experience running and advocating for community eligibility with low ISPs and partial district implementation, to go over some resources from the FRAC end, and to answer any questions that you may have. Next slide. So we have a full agenda today with a host of really great speakers. So I would like to go over that schedule with you all for the webinar. Once I'm done going over this agenda, I will give a brief introduction to community eligibility and making it work with lower ISPs and partial district implementation. I'll then pass it off to our wonderful speakers to hear more from them. First, we have Dr. Patrick Murphy, who is the Superintendent of Berkeley County Schools in West Virginia. And we also have Tracy Heck, who is the Executive Director of Nutrition and Wellness at Berkeley County Schools. And then last but certainly not least, we have Jessica Pino-Goodspeed, who is the Child Nutrition Specialist at Hunger Solutions New York. Following our speakers, I will discuss some of the many great resources that we have at FRAC, and we will save our questions for the end. So please feel free to use the Q&A function to the right side of your screen to ask questions. We're also delighted to be joined by Elaine Bobo at Berkeley County Schools to help answer questions during the Q&A. Next slide. The community eligibility provision allows high-need schools to provide free breakfast and lunch to all students without collecting applications. Schools are reimbursed based on the proportion of low-income children in the school district, and eligibility and reimbursement is based on the percentage of identified students, or ISP. Any school district can use this option if at least one of its schools has 40% or more students certified for free meals without an application, which are called identified students. And these identified students include those who are in two categories. And that is children who are directly certified for free meals through data matching because their households receive SNAP, TANF, or FDIPR benefits, and in some states, Medicaid benefits. And children who are certified for free meals without an application because they are homeless, migrant, enrolled in Head Start, or in foster care. This percentage is then multiplied by a factor of 1.6 as outlined by federal statute in order to determine the percentage of meals schools will be reimbursed for at the free federal rate, with the school making up the rest of the cost of the meals served. As USDA's summer waivers expire on June 30th, 2022, adopting CEP is a great way for the qualifying schools and districts to continue to serving these healthy meals at no charge to students. Next slide. Districts can participate in community eligibility in a variety of ways. And schools with an identified student percentage of at least 40, as I said, can participate individually. And schools within a district can be grouped together in any way as long as the group has a combined ISP of at least 40% or more. And there's no limit to the number of groups that a district can have, and the district can even include one big group for the whole district. Finally, school districts can participate, as I said, as a single group as long as they have the identified district-wide student percentage of at least 40. And grouping, we believe that grouping allows districts to optimize their ISPs to ensure that they can get the highest level of reimbursement for all schools participating. Next slide. We've often heard from our partners, especially several years ago when community eligibility was first implemented, that it's difficult for schools with ISPs lower than 62.5 to participate. And 62.5 is the magic number once you multiply it by the 1.6 factor that gets you 100% of meals reimbursed at the free rate. And as we've seen in our research throughout the years, there are thousands of schools across the country that are comfortably operating community eligibility with ISPs well below 62.5. And the numbers continue to grow. And during this school year, in fact, about 40% of schools operating community eligibility had ISPs below 60%, with nearly 27% of schools with ISPs between 50 and 60%, and nearly 14% of schools operating with ISPs below 40 and 50%, between 40 and 50% rather. Key to making this work is making sure that your ISP is accurate and up to date as possible when states collect this data in the spring, and when making the adoption into the program over the summer so that you can maximize your reimbursement level. Also key is regularly conducting financial analyses of your school nutrition operations to make sure your finances work for your district. And to help with this, FRAC has put together a series of financial calculators and an ISP optimizing grouping tool to help schools and districts figure out the best way to make community eligibility work for your situation, which I'll discuss later on in the webinar. Next slide. In addition to these strategies that I listed on the previous slide, FRAC has compiled a series of best practices over the years that have helped districts make CEP work at lower ISPs and partial district implementation, which include grouping schools together to optimize ISPs and federal reimbursements, implementing breakfast in the classroom or other alternative school breakfast models to increase participation, engaging students to determine their preferences and to get them excited to participate, providing appealing high-quality meals, and promoting your program to students, parents, and the community at large through communications and outreach. We also highly encourage any state that is not currently participating in USDA's Medicaid Direct Certification Demonstration Project to apply to do so, starting in the 2023-2024 school year, with the deadline from which is September 30th, 2022. We've seen in many cases that ISPs do go up after states implement Medicaid Direct Certification, which can help boost even schools with lower ISPs financial eligibility with community eligibility. And we have more research on this on our resources section. And feel free to reach out to your state agency to see if they have applied yet, if they're not already participating. Next slide. I also briefly wanted to go over some details on what community eligibility will look like for next school year. And as many of you are already aware, USDA extended key waiver flexibility for community eligibility for the current school year, which gave states and districts and schools more time and flexibility to adopt CEP for this school year. And because this nationwide waiver authority is set to expire in June, USDA is not able to extend nationwide waivers to extend deadlines, but they have expressed that they are granting states individual waivers to extend these deadlines. And as of several weeks ago, we heard that as many as 30 states have been granted this deadline extension waivers for the upcoming school year. So check with your state agency to see what the deadlines are for this upcoming school year. If your state does choose to apply for deadline extension, rather than having until May 1st to report the list of eligible schools, they can choose to extend that deadline out to as far as June 30th. And rather than schools and districts adopting CEP by June 30th, they will have any time. The state can choose between now and any time between September 30th, although I know that many states will choose a deadline that is before the start of the school year. So make sure, again, to contact your state agency to find the deadlines for your state. Next slide. And with that, I'm pleased to pass it off to our first speakers, Dr. Patrick Murphy and Tracy Heck of Berkeley County Schools in West Virginia. Take it away.
All right. Well, thank you, Allison, and good afternoon to all of our participants. I'm just going to give you a little bit of a snapshot about Berkeley County and where we are located. We're about 70 miles to the west of Baltimore and Washington, D.C., and we're in the Eastern Panhandle. Many of the challenges and opportunities that we have look very different than what you may think about West Virginia. We are very much of a suburb or a bedroom community of the metropolitan area of those two cities, Baltimore and Washington. One of the things I think we've all learned, and I'm very fortunate to have worked with Tracy and Elaine over the last 3 years, is that the advocacy that all of us bring to making sure that students have meals, and we've been able to do that pretty consistently, has been one of the most important things I think we've done during the recent pandemic. The other is keeping our doors open, and I'm proud, or we're proud, that we've been able to do both of those. So we watch very carefully what's happening in Congress. We watch very carefully what's happening with our meals program. And I think, Tracy does just an outstanding job in being an advocate and the importance of her role. And I'm sure that's true in your districts, coupled with Elaine being able to communicate messages very clearly to families. So we've been able to provide food and meals to those that are eligible and have our community take advantage of that. Next slide, just a little bit of a snapshot to give you a sense of who we are. As you can see, we are close to 20,000 students. We have an operating budget of over $230 million. We have a total of professional and service staff of about 3,000. So we're a good size school district, and we have approximately 322 square miles in our district, with 32 buildings and facilities that serve a pre-K through 12 population. The next slide. Recently, though, as being a bedroom community or a suburb of these large metro regions, we recognize that a number of people are being attracted to our area. As we grow with manufacturing and businesses in our community, we are forecasting growth here in the next 10 years of probably over 4,000 students. So we need to be prepared for that with our capital program, as well as with our human resources. But again, I think this afternoon is really about how we are advocating for students, making sure that they have healthy and nutritional meals, and what advocacy can we bring to the plate. Well, this afternoon, I know we're talking about CEP. One of the other concerns that we have, and we're watching very closely, is Congress going to, continue to fund some of the meal programs that we've seen over the past 2 years. So we want to extend that conversation, and this is just a part of beginning to, kick the tires and make sure that we have an advocacy or a voice that's in play. With that as a backdrop, let me turn to Tracy, who makes all of this happen, and her attention to detail, and I'll turn it to you, Ms. Heck.
Thank you, Dr. Murphy, and good afternoon to everyone that's in attendance here. First of all, I am a strong believer in CEP. I want to make sure everyone understands that even though we don't qualify countywide, or we can't make it over the tipping point quite yet, we strongly believe that if we can help so many schools, so many kids in so many schools, at least we're one step towards the future. So just keep that in mind as I go through what we've done in the past and where we're heading. All right, next slide, please. All right, so back in 2012, and I apologize, my slides aren't quite correct there with the indentions. We started at spring of 2012, when West Virginia was allowed to be one of the guinea pig states. We started gathering inputs, consideration from the stakeholders, and I'd like to say we've been going through this for about 10 years, minus the last 3 years of 2.5 of COVID. I've been able to work the numbers, lock things in, and add schools. We started out with an initial 6, and we are now up to 16 out of 32. So I feel like we are making progress. You can see our board approves everything that we do when we add the schools. Some years we had to stay in place and just ride the tide until the next year's DC numbers came out and the ISP numbers, and then tried to find ways, what else can we do to think outside the box? Next slide, please. So once again, 2013, the initial thinking was there was our first group of schools, and what we looked at were those 6 locations. And take note that I have some letters beside there. It says A, B, and C, and we'll talk about that here in just a minute. Rethinking for growth, we went back in the following year and we added just 1 at that time. Later down the road, notice also under Rethinking for Growth, we still have the groups A, B, and C. And by the time we've got to right before COVID, we had up to 16. And at that point, we were able to put everybody into one group of Group A. All right, next slide. So the big thing that I tried to do, and I always laugh, I call it locking into a mortgage rate. What can we invest and get our biggest return? So right here was one of our very first ones from that spring of our qualifying numbers. Even though we had other schools that did qualify, what we were able to handle at that point were those first 6 schools on that list. Yellow is the Group A, green is Group B, blue is Group C, and you can see where our numbers landed right along that point. The wonderful thing about the top school, Burke Street, was paid off in the long run because of the 119% once you include the federal multiplier. So that is the reason why we went ahead and added that school to Winchester and Berkeley Heights, because Berkeley Heights is one of our larger elementary schools. And at that year, it looks like it was sitting at 836 kids. So we knew that would help us in the long run. All right, next slide. All right, so back then we have this format that our state gave us, and if you look at that carefully, I did the calculations from August to April 16th. I actually put the date that time. We put how much students pay. As you can see, our reduced students don't normally pay anything for breakfast, that they do for lunch. And back then we had little cheaper rates going on for pricing. So what we did, we compared the traditional model with the CEO or CEP model, and to see what is best. And if you look at the bottom of this chart, it says traditional claiming provides greater reimbursement. Well, it would have if not have taken the gamble of participation. So the light blue block to the right is how much we increased in meals served. So we took a gamble of 10%. And when we did that, you can see that the CEO claiming increased meals went up to 144,592, that with just the increase. All right, next slide. So the next thing we look at these is we look at our participation. So I kept a lot to see, did we make the first choice or the best choice for the first year? This is my a chart I kept from back then, from 12 and 13, financial year 11-12, which was before CEP, and the 12-13, which is the top chart, is after CEP. I took it all the way through March at that point, and you can see just with those 6 schools, comparing both, we went up, 22,000 meals in the same amount of the last average days, because my divisors weren't right in there. But the yellow blocks can show you, like I said, the top is with CEP for the same amount of days, and the bottom is prior. So we definitely saw the increase, and that was wonderful. Next slide. Right here, what we determined when we did CEP phasing in, from 2013 to 2017, I was able to pull this information. You can see what our breakfast is up. You can see going across our FY means financial year for us. So you can see the increase over time with our participation. Here and there, you might see a drop, and that might be because a school lost a grade level or lost a pre-K or something like that. So that's a little bit of a difference. Our lunch numbers increased as well, and we found it very beneficial. And over time, I would suggest that everyone track their data because data talks. Next slide. So input and things to consider. First thing is to remember that April 1st date. Make sure that you work your list, your check direct certifications. We found ways of doing different things from the school perspective, having our Title I teachers help us figure out who is in actual families, etc. The second thing there is the blended pre-K models and Head Starts. We have 10 outside pre-K or Head Starts that we feed out, and we needed to figure out where were they going to be, what was their home school going to be, where would those kids be enrolled, even though we are feeding them at that site. But in our state, they could not exist as a school. They have to be tagged on to one of our 32 schools. One of the other things that we went through during this time is we added schools. So each time we had what's going to be the size of the new school and the existing school. And if it's a CEP school and they're going to take a grade level out, how does that affect your ISP? What's the future? Can you make up that difference? And the fourth thing I brought up was your staff size. Can they handle an increase? So those are 4 things that were big for me that first year or so. Next slide. So our steps for growth. First of all, like I said earlier, find ways to identify the students and households before April 1st. I strongly suggest you conduct a financial analysis based on participation and your costs throughout the whole thing. That does make a big difference when you're determining what works and what doesn't work. Earlier, you saw a chart that had other schools that did qualify or could qualify for CEP, but their participation was not high enough for us to, I call it, get over the tipping point. You need to also determine what is your tipping point. And when you look at that, you need to look at your expenditures to include staff side, food costs, supplies. And what's the magic number? For us, my magic number to even get to countywide is 75% with the index. So the next part there is group schools based on your ISPs to get the best operational return. So I took those charts that our state provided us. I would put group 3 schools together. Did this work? What if I put these 2 schools together? Does it give us a higher return with the expenditures? Work it, just keep working it. And it sounds like FRAC came up with some great things, tools to use for the future, and I'm anxious to see those. Determine your staffing costs and their schedules. So that is huge for us. To pull this off, can they, in our district, our cooks work a 7-hour day with a half-hour lunch. So can they pull off this 10% increase that I predicted would happen and still be able to get their lunch time, meet all the requirements, and could we stay within range to include their attendance bonuses, et cetera? That any kind of district things that we would have to cover in the long run. Determine areas in which service may increase. So we had a law in the state that every school had to do a breakfast initiative, and this law is called Feed to Achieve. And we, as a county, determined that the best thing to do is breakfast in the classroom. Some formats of delivery to the classroom, sometimes they are grab and go. And with that, we saw a huge increase, and you can see that in that prior slide that shows from financial year 14 through 17. We also implemented things like grab and go lunch. We had a lot of band students who do extra practice at the high school levels during lunchtime, and they were skipping lunch in order to do that. So we made a decision we would do grab and go so they could go spend their free time up wherever they need to be. Collect the financial data on your outstanding balances. And I think part of my slides cut off there in select schools. So what were your balances before? Did a student have a $400 balance, and then over time, the outstanding balance went down? Since the parent is no longer making the payment, daily lunch payment, and the account still building, were they able to take their funds and lower their accounts? So I did that, and you'll see that here in just a minute. During the CEP time, Steps for Growth, collect daily data, determine what meals work, what meals are great, stars, and which ones are the losers. I know for a fact Salisbury Steak in our county is outstanding, and that's one of my highest paying earners. Other than that, fish sticks do not do well. So then we had to look at our menus and determine what's a great thing to go with, what's not a great thing. We also did student surveys and taste tests to determine the thumbs up. We use NutriSlice also for students' online menus, so they can also rate the food as well. So if we know that a side item didn't do well, we would kind of look and see what the reviews are from our students. One big thing that we realized where we could make the money, our lunches for adults are like first breakfasts are $3. We decided we needed to market, and where we could market and make up some of the things are with our adults. So we looked at making box salads, and we sold a lot more to adults as well. With that, a lot of teachers don't have time to run out and grab something, and a $4 full meal is a pretty good deal, especially these days. We marketed locally grown. We did special days. We worked with our multicultural and diversity assistant superintendent. We did for Hispanic month, etc. And anytime we did those types of things, of course, our participation shot way up. You have to determine how are you going to communicate this to all the parents, students, staff, and even your community. And Elaine was a big help in helping me get things made up, whether it was postcards at that time. We have I call it's In Touch, and it's where you send text messages, and maybe Elaine can share more with that, about what benefits different schools. One thing I would say is compare your outstanding account balances from August to June. Beforehand, I said you make sure you grab that information and then compare it at the end. The last thing, and it's the hardest one I had to learn, is determine the best enrollment school for those, quote, other feeding sites. For example, our Head Starts that are outside of the building that we do feed them. Where do we enroll those sites? And if there's two schools, both of them within a mile of each other, which school is the better one to put those in? Because that helps with your, and of course with your direct cert number. Next slide. All right, so at the top, I just gave some real quick snaps of some of the data that I collected during that time. If you look at financial year 13, which was our first full year compared to financial year 12, you can see in each of the schools the increase in reimbursement. So it worked out wonderfully. When we went to look at CEO expenditures, our differences, of course, it went up by 92,000. But when you add up all the increase and the difference in the chart above, it was pretty nice. The supplies wise, we did have, some of that is dishwasher issues, etc. Did go down implementing some of the box salads, those types of things. And as you know, changes in market there. Our milk differences, of course, went up. But overall, our employees, how much we went through everything, where we had to add and where we had to go away. So our expenditure diff was 154,000 at that point. But if you look at the top reimbursement chart, if you look at the bottom right corner, reimbursement came in at 375,000. So we came out ahead. So it was worth it in the long run. Next slide. All right, so outstanding balances and I know every school and school district across the nation does this differently. We are not a prepay district. Students, we send out bills once a month, and they have so many days to pay the bill. So if you look at financial year 12, that's pre-CEP, and compare it to financial year 13, you can see basically those first 6 schools down to the totals that we brought in. The parents made up $20-some thousand there. or $28,000 that they were able to pay off just by using CEP. That's a benefit to those families, in my opinion. The bottom line there says OPEC and basically I was looking at that one at that time, which the following year I did add OPEC in to one of our groups, Group C, and brought them on board with CEP. The staffing, we compared that. I kept this data also to see where we needed to change. And the first year I did have to add staff to Berkeley Heights, Tuscarora half-time, and Eagle School I brought in a full-time at that point. So those, of course, those numbers for their salaries are in that chart, the slide before. All right, next slide. This is a great spreadsheet that one of my neighbors here to the east of us used back in the day. And this is their information, but I want to show that you can put all this information into one, and they broke it down month by month with student enrollment, the participation, days of service, and how much they increased. And they grouped theirs into two groups out of 3 schools, 2 in one and 1 in the other. So I just wanted to share that and let you know that is a different way of looking at different things. And at that point, Allison, I think we are good.
That was absolutely incredible. Thank you both so much. This was so incredible. With that, I'm excited to introduce our next speaker, Jessica Pino-Goodspeed from Hunger Solutions New York. Go ahead, Jess.
Thanks so much for having me. It was great to hear all the wonderful things happening in Virginia. I'll hop right in. Next slide is where I'm from. So I am from New York State. We are Hunger Solutions New York. We're a statewide anti-hunger organization. Our mission is to increase awareness for in participation in all the federal nutrition assistance programs. So here's the list of the different programs that we work on. As a child nutrition program specialist, my area of expertise is in school meals. And so I've been working on community eligibility since its inception in New York State. So next slide. I'd love to talk to you and just set the ground a little bit of what CEP looks like in New York and a little bit about the demographics here. So next slide. So like Virginia, we were an pilot state. We implemented in 2012-13. So I will be going into my 10th year of CEP Outreach and Advocacy this coming season. We have pretty strong uptake in New York. We're about 63% of our schools across the state operate CEP. That equates to about 3,600 schools across the state. And so that's a mix of all different types of schools, from small public schools to like rural schools with lower ISPs as well. So next slide, I wanted to just show you a little bit about what our demographics are of CEP school districts. So of those 3,600 plus schools, where do ISPs kind of lay out? So you can see the majority of our schools have higher ISPs. 85% are above that 60% ISP, but we do have participation in about 15% of our schools. At less than 60% is kind of how I parse that out. And you can see with that ISP of between 40 and 50%, about at 250 schools in New York. So next slide. Through the years, we have really taken the time to look at who is not participating, and now that pool has really decreased through time, right? And so we have a smaller, much more targeted approach now for our community eligibility. There's about 200 additional schools roughly across the state that are eligible and not participating in CEP. And the majority of those schools have low ISPs or are in a situation where they're unable to implement CEP district-wide. From knowing and anecdotally really like kind of knowing these districts, many of those schools are rural schools or suburban schools. The majority of our urban districts are already implementing. And really also anecdotally kind of learning from those schools, because it's not that we haven't touched those schools completely through this outreach over these last 10 years. but kind of learned more about who they are and the challenges they face for implementing CEP. So I just wanted to share some of those here and just some observations through the years of who are the ones who are kind of these outliers after, you know, some pretty strong statewide uptake in the program. So in particular, in New York, there's not always a dedicated school nutrition director or food service director. Sometimes it's someone in the business office or the superintendent's office who is managing a contract with a food management company. And so there's often not a point person necessarily working on that program. And so we find that that's a common characteristic of these schools with lower ISPs, or who, you know, what I lovingly refer to them as late adopters. So across the table with these other districts, a lot of them, like other schools with low ISPs, they're concerned about a loss of reimbursement revenue because of their ISPs not being high enough. There's also some real concerns about loss of free and reduced price application data. This is required in New York State, so this is a state-by-state specific piece, but in New York, this is a challenge for us. And also really a common piece that I see with districts in this boat, they often have room for improvement with their local direct certification practices. So a lot of technical assistance is something that we have been ramping up more and more through the years to help these late adopters. So next slide here. Really, over the last 10 years, our messaging around CEP has changed and really morphed through time. And so our goal is really to aim to respond to the issues facing education leaders and school nutrition directors. And so in order to do that, we really need to be listening and connecting to school districts. So I'd love to share with you a little bit how we do that. So next slide talks about where we're plugging in. So we're a lot of times conducting our own surveys of districts, especially during this pandemic time where schools are still operating waivers and offering free meals for all. It's reopened this conversation about free meals for all. And having it be a lived experience for communities across the state has really opened up this conversation. And also just the economic fallout of the pandemic has really elevated the issue of hunger and food access in districts across the state where it hasn't really been a central conversation. So we connect by surveys, we do virtual roundtable discussions, hold Zoom sessions that allow directors or business officials, superintendents to come and have conversations about these concerns. We also make sure that we're connecting with our state agency to hear about barriers that we may not be connected to those certain school districts. I wanted to highlight our Superintendents Association each year does a policy survey to hear the top concerns of school superintendents across New York State. And so here I just listed out the top 4 concerns, all very closely linked to food insecurity. And we see it as really our role is to help educate to schools about the resources available, and community eligibility is a huge piece of this, making sure that our students are well fed in order to be able to be well physically, but also mentally and emotionally, and also a huge support for families' economic circumstances. So it's been helpful to be able to talk about CEP in that way. So next slide. A lot of our conversations with superintendents and with decision makers really at school districts, whether that's the nutrition director, superintendent, whether it's a school board, we're talking about all the research around community eligibility. And we have almost 10 years experience in the state of how community eligibility has benefited students and schools and really addressed some of the concerns that are coming to the top for districts. So I won't spend too much time on this, but I do want to highlight too, you know, there is a real concern about child hunger. And so a big point that we talk about often is that CEP schools who are eligible and participating, those kids attending those schools are 3 times less likely to be food insecure. And so we always talk about what a powerful tool schools have right at their fingertips, although there might be challenges and barriers that these resources are available. So next slide talks also about just some other key messaging coming off of the pandemic and off of the waivers. How do we talk to school districts about the concerns they're having about operating their school meal programs? There's definitely concerns around operational barriers, but also access issues. So we're really looking to communicate these key messages throughout this upcoming school year about continuing to offer free meals as we come off the pandemic and revert back to normal operations. Can CEP be an opportunity to maintain some consistency in your school district? There's also a lot of concern across the state about school meal debt. New York State has legislation to safeguard children from harmful lunch shaving practices. There are unpaid meal policy, certain things that school districts have to follow. So it does create more of a labor for school districts to collect that debt. And so definitely a real issue and a big concern for September. I talk about locking into CEP as a no-risk opportunity. We haven't seen this in New York, but at any time a school can back out of CEP. You can adopt and see if that type of funding works well for you. And while that locks you in for 4 years, there is always an option, an exit strategy is like how I like to talk about it. Other piece of ISPs, and we'll talk a little bit more about the resources that we've developed, but we always talk about unmet need in SNAP. So we know SNAP and Medicaid participation. So Medicaid, we are also a Medicaid state. I think I glossed over that at the beginning. But as your ISPs increase, and that could happen by nature of connecting with some community-based organizations that do SNAP outreach, or the school themselves conducting some awareness around SNAP. And many of our low ISP CEP schools, what we've done since then is engage them with SNAP outreach, and in an effort to increase their ISPs, because we know a lot of families, and especially being able to kind of target those families of who comes in through a school meal application, who's pre-certified, and not coming in through direct certification. Schools really kind of have that ability to target those specific families. So we're always encouraging SNAP outreach as a way to increase, and then the structure of the program allows you to reapply at a higher reimbursement rate. So it's a win-win for families and for schools. We also talk about how CEP can help unlock other benefits for both the school district and families. We saw this with the rollout of pandemic EBT. Our strong uptake with CEP in the state has really unlocked a lot of benefits for a lot of families through the PEBT program. But also we have some state-specific pieces where in CEP schools, children can get band equipment waivers, fee waivers waived. They also can get discounts on AP courses, so advanced courses or college courses. And so in a CEP school, what that looks like in New York is everyone in that school is eligible to those discounts. So it's a really great benefit and often overlooked. So there might be some state-specific benefits as well that is worth looking into. So next slide here. I'd love to talk to you a little bit about, the tactics that and how do we get these messages across? How are we connecting with districts in a meaningful way to get these great points across? So next slide talks a little bit about our plans for the 22-23 school year. We still have 8 more weeks of school. Our deadlines are still up in the air. So we're kicking off as soon as this week to really talk to different stakeholder organizations and provide them with our resources. Specifically, this is superintendents associations, principals associations, also our school nutrition association as well. We often run ads, we run articles, send newsletters, newsletter articles, or even advertisements to let them know that we provide free services to school districts. We work one-on-one to help them with that application process. We help think through the fiscal implications of CEP and all these other factors that they might not be considering. So really kind of using those stakeholders and those partnerships that we've built through the years has really helped us leverage some good conversation and also get our names out there that we're here to help with CEP. We also really work to continue to cultivate a relationship with CEP schools who have adopted at the lower end. I said about 200 or so schools are in that 40 to 50 range. And I will say that a lot of them I worked one-on-one with. Those districts took a lot of time to improve their local direct certification practices, make sure that they're capturing all the right families, especially with household eligibility extension. And so we built a relationship through that period. And since then have really become champions to help peers with who are in the same situation with low ISPs and looking and really needing to do a lot more of the legwork to try to make the numbers work. So it's not as formal as it probably sounds, but it's more just having a list of directors that I can easily connect a similar district to has been really helpful through the years. A lot of times they join on webinars like today and to talk about their experience and their process and how one-on-one assistance from us helped. So that's been fruitful. Last 200 schools or so, what we'll do as well is just engage them one-on-one. So a lot of times that's cold calls. Sometimes it's, who has a relationship in that district and could we connect in that way, but we are communicating with them directly and reaching out. So lastly here, I just wanted to show you a little bit of through the pandemic, we've really worked to create some resources hearing about this concern of coming off waivers and reverting back to standard operations, but also kind of a new time to build buy-in and help with CEP schools. So next slide here is just an introduction slide to our resources. So these are ideas. We have been helped by so many states, different advocates with their ideas. And so we're all about not recreating the wheel. So, and if any of these, if you're an advocate and if any of these would be helpful to you, please reach out. I'm happy to share. And we're a big community here, so we want to help. So next slide here is our first resource. This is probably my most used technical assistance resource. So this is gleaned largely from FRAC's resource on improving strategies for direct certification, because there are some universal things that need to happen, like which categories of kids should be included, extending eligibility to other household members for SNAP and Medicaid. But there are some state-specific things of when that data is uploaded. In New York State, that's each month, but that's a change from 5 years ago. That was only every quarter, right? And so there are also different search functions that are specific to our state. So we found it was really helpful to have a state-specific direct certification resource to really speak to what the reality is in your state for direct certification. Our statewide system only has SNAP and CEP. And so I think the most common barrier that we saw with direct cert was schools just looked at that state file. And so they were not capturing homeless kids, foster kids, migrant kids, so some of the other categories that weren't included in that direct certification. So we know direct cert is crucial for CEP, but also this is really helpful for anyone, right? Especially these smaller rural districts that don't have a dedicated food service director. It's really important that we're providing additional assistance with direct certification. So next slide is our school meal application toolkit. Like I mentioned, so this might not be relevant for you if your state doesn't require CEP schools to collect income data. our state does and has often been cited as a barrier. And with coming off the pandemic, there are schools that can't adopt CEP and will be going back to this. So we want to make sure that we're providing some information to make it easy for schools to collect household income data, and really a copy paste for them to be able to do social media, to add to their newsletters and their communications to families to help collect income data, and in some cases for reduced price applications. So next slide is our SNAP Outreach for Schools toolkit. This toolkit was created at the start of the pandemic and was used a lot with grab and go sites where, when schools were closed in New York State, all schools closed for the entire school year after March 2020. And so this has been a continued helpful resource for school districts with CEP, and just wanted to highlight that. Next slide. And so if I can be helpful to you, I know I've talked to a lot of other state advocates, and if I can be helpful, and if these resources would be helpful for you to customize for your own state, feel free. And I'm going to pass it over to Allison with FRAC's resources. I know that they have a lot of stuff there too. Thanks, Allison.
Awesome. Thank you so much, Jess. And to Tracy and Dr. Murphy as well. You all have such incredible insight, and we all really benefit from it. I just want to go over briefly some resources before we go to our Q&A, because I know that people will likely have questions. So first of all of these resources that I'm about to talk about are available on our community eligibility website, which is at frac.org/community-eligibility. So next slide. The first I want to briefly touch on is our community eligibility database, which has been updated with all of the latest data for the current school year for all schools in all districts in all states across the country. Next slide. Another key resource that I alluded to earlier is our grouping tool, which is really great and has been updated to make sure that it is working and functional. As discussed earlier, schools and districts can group multiple schools together to maximize ISPs and federal reimbursements. And we designed this tool to make it easier for people to upload a list of schools in your district, a designated target ISP, and then it'll pump out a list of potential groupings that you can create to optimize ISPs for your district. Next slide. We also have a series of financial calculators, which we know are super helpful, and these are both available in Excel spreadsheets that you can download from this website, or as actual web interface tools that you can use and you can plug in information. We have a break-even calculator, which looks specifically at schools, and it's pretty top level. Then we have a district level calculator that goes more in depth, and a school level calculator that goes even more into granular detail. Next slide. The break-even calculator allows schools to use their ISP and some basic information about school nutrition operations and expenses and labor hours, etc., to calculate the participation you would need in breakfast, lunch, supper, and/or snack to break even with community eligibility. Next slide. We also have the district level calculator, which allows districts to dig deeper to look at expenses and revenue under community eligibility by school type and compare implemented community eligibility to different operations. Next slide. All of these resources that I've spoken about are available on our community eligibility website, in addition to a number of reports and one-pagers and etc. that we have available, and you can see in this on this slide. All of these links are serviceable, and once you get access to the slideshow after the webinar, you can click on these links and visit all of these resources. Next slide. And at this time, I know we have about 5 minutes before our time, but we are going to turn it over to our audience for questions. And again, please use the Q&A function to the right of the platform window to ask your questions. And the panelists and I are going to do our best to respond to them and answer them. So I have a question from Ariane. When adding a school below 40 ISP to a group, can you include the directly certified students enrolled in that school towards your overall ISP average? I noticed in FRAC's grouping tool that it zeroed out the direct certification enrollment in those schools, and I hadn't seen that in the guidance before. So if you have a school that you're looking to group that is below 40%, and you're looking to group that with other schools to get the broader overall district, group ISP of 40% or higher, it should count all of the directly certified schools in that. When you're grouping the school, it'll take all of the identified students in the entire group and then divide that by all of the enrolled students in the entire group to get a group-wide ISP. So all of those direct certified students should be included. So we have a question from Josh about what program improvements have been made the most effective to boosting participation to the tipping point, and anything that decisively tipped the scales. And I think Tracy would be a good person to answer that question.
Okay, I definitely want to say breakfast in the classroom was the biggest tipping point for us, especially when our superintendent made it go county-wide or school district-wide, and implementing breakfast after first or second chance breakfast at the high school levels. We had a very low percentage of participation, and it shot us up to 40, from like 20% up to, I'm going to say, around 40-something%. So definitely with breakfast, it was the huge boost.
Awesome. That is really good advice. That is good advice. And we've seen breakfast in the classroom in a lot of different places really make a big difference. Do we have any more questions? If so, please feel free to put them in the Q&A or in the chat. We are happy to answer them. We've got a dream team over here in terms of people with really great insight to answer your questions. I'll give people another minute or so to send any questions that they may have. And Nora, I did see your question, and I dropped my email address in the chat if you want to reach out to me, and I'm happy to walk some stuff through and walk through you with some things. Well, it looks like we don't have any more questions, so I think we can go ahead and wrap up today's webinar. Next slide. Thank you all so much for joining us, and a special thank you to Dr. Murphy, to Tracy, to Elaine and Jess for joining us and for sharing your expertise. We are really appreciative, and I know that everybody really benefited from your insight. The recording and the resources mentioned will be shared in a follow-up email that will be sent later. And in the meantime, please don't hesitate to reach out to us if you have any questions. My email address is aperez@frac.org. I'm happy to answer any questions that you have or to connect you with anybody that spoke today if you're interested in connecting with them as well. Thank you so much for joining us, and we'll talk to you soon. Bye, everybody.